The mission of the Marfan Foundation is to save and improve lives while creating communities for all individuals with genetic, aortic, and vascular conditions, including Marfan, Loeys-Dietz, and Vascular Ehlers-Danlos syndromes. These conditions affect people worldwide, and it's our goal to support them, their families, and the medical professionals who care for them.
As we've come to better understand the science behind these conditions, we've expanded the foundation to include these 4 divisions.
Since we have had the backing of the Marfan Foundation, things have just so rapidly gotten so much easier and better for parents and families.
If you have a collection of doctors that are working on your issue at the same time, you get a much more complete answer. And that's what the foundation brings to that.
Partnerships are absolutely the key to victory. And that's why we're grateful to have the GenTAC Alliance as part of the Marfan Foundation.
It's really led to fantastic international collaboration in the research realm, in the patients, families, and clinicians area, in clinical research, in database growing, in finance and business aspects to help support this.
The research that the Marfan Foundation has supported for many years has led to a better understanding of genetic, aortic, and vascular conditions. It's also improved the lives around the world for those who are affected.
When I was born, the average life expectancy for someone with a genetic aortic condition was 30 to 40 years. Now with medical intervention, people have normal lifespans.
It's amazing how much the education has proliferated to other professions within the medical community, not just primary care physicians, not just emergency physicians. That push, that drive to educate all these medical professionals has had tremendous results.
The information that is provided by the Marfan Foundation on its social media and on its website is backed by the medical professionals that are experts in vascular Ehlers-Danlos syndrome, and it's the most trusted source for information in the United States.
We have an amazing help and resource center for affected people and their families. It's usually the point of entry for somebody that has been diagnosed with one of these conditions, and it's the beginning of their journey.
It has been so helpful because the questions I didn't know I had, they answered. I'd put in a call to the nurse's line, and then it just relieves me and gives me, peace of mind. I'm very thankful that it's there.
The biggest thing that I think people learn when they come to conference is if you have a question, someone's probably most likely experienced something similar, and it gives you a peace of mind to know that you can reach out and ask those questions.
The most amazing part is the medical assessment area, where I was able to meet renowned specialists in different fields, and also I met Marfan community.
Camp is the place where my heart really resides because camp is a really great, safe place, and you can feel comfortable while also learning that independence in a place that doesn't make you feel different for what you can't do, but celebrates you for what you can.
The Marfan Foundation has allowed us to connect with people that's just like you, just like so many other people with this condition. So without the Marfan Foundation, a lot of connections would have not happened.
The foundation is recognized throughout the nonprofit industry for its commitment to accountability and transparency. We are diligent in how we use our resources, and I'm proud to say the foundation has received the highest ratings on Charity Navigator and GuideStar.
Historically, the foundation has supported international research in genetic, aortic, and vascular conditions. As we expand our mission, we're now looking to provide additional patient support and awareness in locations outside the United States. For example, our website is now available in more than a dozen languages, as well as a number of our other research materials.
I know that there's other people with Marfan in Costa Rica, but I've never been able to connect with them. Once you connect with that foundation, you're never gonna be alone again.
So I think the value of having all of the aortic conditions together in one community, it's more of feeling like you're at home.
I've made some of my closest friends through the foundation. It was definitely helpful to just see that I'm not alone.
I've gotten to not just live longer, but actually the level of my care is vastly better.
I'm living successfully with Loeys-Dietz rather than living in fear of Loeys-Dietz.
The future for individuals and families with genetic aortic conditions has never been brighter.